Hello, so I'm going to lecture chapter 24, the skin. This begins on page 364 in the textbook. This is figure 24.1, which shows you the structure of the skin. Skin has three main layers that you can see here: the epidermis, the dermis, the subcutaneous tissue. You can also see the subcutaneous gland, receptor, subcutaneous fat. We're shown different layers here: the stratum corneum, stratum lucidum, stratum granulosum, stratum germinativum. So the skin is the largest organ of the body, performing several functions, including mechanical barrier to infection, sense of touch, regulation of body temperature, excretion of waste, products and salt, synthesis of vitamin D as well. The epidermis is the outermost layer of the skin. It contains melanocytes, where pigment is stored. This is the thinnest skin layer, and it's also known as the scarf skin or cuticle layer. So as mentioned, the skin has three main layers. The dermis is the middle of those layers. This contains fibroblasts. It's responsible for secreting proteins, collagen, and elastin, which support elasticity. Contains immune cells, hair follicles, blood vessels, and sweat and oil glands. Location of the sensory receptors for touch, pain, heat, and cold. Helps maintain body temperature. The subcutaneous layer is the deepest layer of skin. It's the outermost part of the muscle is located here. Stores adipose or fat tissue, contains connective tissue, and this is also called the hypodermis. So diseases and conditions of the skin. The first we're going to look at is rash. This is on page 364. This can be an area of red inflamed skin or a group of red spots. It's caused by irritation, allergy, infection, or defects in the skin structure. Pharmaceutical treatment can include antihistamines and topical corticosteroids. Eczema is a skin inflammation with red pimple-like bumps. It's characterized by itching, blistering, or oozing areas that progress to scaly, brownish, or thickened skin. Pharmaceutical treatment can include topical immunomodulators. Psoriasis is non-contagious chronic immune disorder. Specific immune cells become overactive and release excessive amounts of proteins called cytokines. This causes inflammation and it is painful, often disfiguring plaques. Pharmaceutical treatment includes topical steroids, oral antibiotics, and immunosuppressants. Table 24.1 shows you prescription and over-the-counter treatments for psoriasis. This is found on page 366 in the textbook. And the textbook is actually a little more detailed. Skin infections. This begins on page 365. Viral infections occur when a virus infects the inner layers of the skin. Examples would include herpes simplex, warts, and shingles, which are all forms of herpes. Pharmaceutical treatment would include anti-inflammatory steroids or antihistamines. Bacterial infections occur when bacteria penetrate the skin and cause opportunistic infection. Most common bacterial infection is the Staphylococci or Streptococci and Pseudomonas. If left untreated, they may spread throughout the body, causing systemic infections. Examples of this include cellulitis, impetigo, folliculitis, Pharmaceutical treatment can include oral antibiotics. Fungal infections occur when harmless fungi gain entry into the skin. This usually occurs externally, affecting the skin, hair, and nails. Examples are athlete's foot, jock itch, ringworm. Pharmaceutical treatments are usually topical antifungals. Acne. This is caused by bacterium and overproduction of sebum, clogging hair follicles. Extra sebum accompanies increase in number of hair follicles during puberty. Non-inflammatory would be the whiteheads and blackheads. Inflammatory would have apules, pustules, nodules, cysts. Pharmaceutical treatment would include topical antiseptics. Exact cause is not determined, but not caused by eating chocolate or greasy foods. Thank goodness, right? So factors increasing a person's chance of developing acne include hereditary, hormone change, medications, makeup, and then here's some more of those over-the-counter treatments for acne versus prescription treatments for acne. These tables are found on page 367 in the textbook. So next we'll look at cellulitis. Again, we're on page 367 in the textbook. Cellulitis is acute, deep infection of the connective tissue accompanied by inflammation. It is caused by Staphylococcus or Streptococcus or another bacterium producing enzymes that destroy skin cells. Pharmaceutical treatment is usually oral or IV antibiotics. Hives begins on page 368. These are elevated red bumps that itch, burn, and sting. Scratching spreads the hives. This can lead to contact dermatitis and other skin conditions. Treatment includes hydrocortisone or pramoxine with zinc acetate creams and antihistamines. If breathing problems ensue, patient should be taken to the emergency room. Parasitic infections. These are caused by insects or worms that burrow into the skin to live and or lay eggs. Examples would be scabies, lice. You also hear some people contract pinworms. So pharmaceutical treatments would include antiparasitic topical agents. There are some prescription oral agents as well for when it comes to things like the worms. Coincidentally, any patient who has a prescription to treat a parasitic infection should be told to wash in very hot water or dry clean all recently worn clothing, underwear, sheets, pillowcases, and towels, because there may be larvae or eggs on those items. The next we'll move on to tumors and cancerous growth. We're still on page 368. This occurs when skin cells multiply or reproduce faster than normal. Cells without mutation are non-cancerous or benign. Tumors or skin growths with mutation are cancerous or malignant. Pharmaceutical treatment can include topical chemotherapeutic agents, immunomodulators, NSAIDs for precancerous actinic keratosis, basal cell carcinoma. This is the most common and most curable skin cancer. It occurs on epidermis, usually face and scalp, mostly caused by early, frequent, and extended sun exposure. Accounts for 25% of all new cancers. Here's a figure 24.2 of basal cell carcinoma. And this is again on page 368. Squamous cell cancer is the second most common skin cancer. Develops an outer layer of epidermis, grows and spreads rapidly. Backs of hands, ears, edges of lips are the most commonly affected areas. This accounts for about 20% of all skin cancers. Can metastasize and invade distant organs and tissues and become fatal. Malignant melanoma is the deadliest form of skin cancer. Signal is often a mole that changes shape or color and may begin to bleed. This can be cured if caught while tumor is still thin and localized in epidermis. The figure 24.3 is showing an example of what a malignant melanoma would look like. Table 24.4 shows prescription treatments for skin cancer. This is found on page 369 in the textbook. Precancerous conditions such as actinic keratosis or AK, also called solar keratosis. This is characterized by scaly or crusty bumps that originates on the skin surface. It may be light or dark and tan, pink, or red, and is usually rough. Develops slowly, about 5% of AK becomes squamous cell carcinomas, considered a precursor to cancer or a precancerous growth. Pigmentation disorders. This is page 369. Skin color is determined by the amount of melanin produced by the body by melanocytes. Hypopigmentation is a loss of skin pigmentation. An example of this would be a condition known as vitiligo. Hyperpigmentation is excess skin pigmentation. Examples would include freckles, age, or liver spots. Miscellaneous skin conditions and diseases. First, we're going to look at hyperkeratosis. This is excess keratin, which causes skin to harden and thicken. Examples would be calluses, corns, and warts. Wrinkles is a breakdown of collagen and elastin within the dermis and reduction in size of fat cells in the skin combine to cause sagging skin. Reduced sebum production makes skin thinner and drier. Rosacea is a chronic disorder of unknown cause. Skin on face becomes red with pimples and lesions, sometimes nose is enlarged. Can be treated, not cured, with topical antibiotics such as sodium sulfacetamide and oral antibiotics such as tetracycline or metronidazole. Spider veins. These are broken blood vessels that enlarge and become visible through the skin. Burns are characterized by their cause into thermal, chemical, electrical, friction, or sunburn categories. Categorized by severity, first degree, second degree, third degree, and fourth degree. Rule of nines to estimate body surface area burned. Sunburn begins on page 370. This is visible damage from exposure to UV rays. It affects the top layer of skin only. It's painful, can cause itching, peeling, and redness. More severe sunburns cause skin blistering and swelling. Decubitus ulcer also called a pressure sore or bed sore, is an ulceration of skin due to pressure, prolonged friction, or exposure to cold. Range from mild redness and blistering to severe deep tissue wounds extending to bone or through organs. 67% of pressure sores occur on hip and buttock, and that's usually from pressure, because those are the areas that, if we're bedridden, are going to be on the mattress the most. So factors that increase the risk for the decubitus ulcer include fragile skin, being bedridden or in a wheelchair, chronic conditions such as diabetes or cardiovascular disease in which circulation is impaired, malnourishment, older age, urinary or bowel incontinence, inability to move body parts without assistance. Decubitus ulcers are classified in stages by the depth or degree. So stage 1 is a reddening of unbroken skin. Stage 2, an abrasion is present with a blister or superficial ulceration. By stage 3, a crater-like lesion is extending through subcutaneous tissue. In stage 4, lesion extends through skin into muscle, bone, tendon, or ligaments. Table 24.5 illustrates prescription and over-the-counter treatments for ulcers. This is on page 370 for you to look through at your leisure. Next, we're going to look at warts. These are hard, bumpy, rough pieces of skin which have accelerated growth caused by the human papillomavirus, or HPV. They can be contagious, or they are contagious, can grow virtually anywhere on the human body. Treatment options range from waiting for the wart to resolve on its own to topical medications and injections to removal by a physician. Page 271, page 371. Table 24.6 shows prescription and over-the-counter treatments available for warts. Athlete's foot. This is a common fungal infection of the extremities. It can be painful, has itching, burning, and possible skin peeling. Can be treated with over-the-counter remedies. It's contagious but not serious. Fungi live in warm, moist areas like hot tub, showers, and tubs. Table 24.7 on page 371 details prescription and over-the-counter treatments for athlete's foot. Next, we'll look at herpes. So there are different viral diseases that include blister-like sores or vesicles on mucous membranes. Herpes simplex 1 is oral herpes causing sores around the mouth, spreads through kissing or sharing toothbrushes or eating utensils. Herpes type 2 is spread through sexual contact, cannot be cured, but can be controlled with medication. Table 24.8 on page 372 details prescription and over-the-counter treatments for herpes. Impetigo. This is more common in children. It is caused by streptococcal bacteria. It's extremely contagious, presents with small red sores that develop into blisters, which break open. Sores ooze, are crusty, and coated with yellow crust. Treatment includes antibiotics, topical ointments, and isolation to prevent spread of infection. Table 24.9 on page 372 details prescription treatment for impetigo. Next, we'll look at lice, which begins on page 373. These are parasites, Pediculus humanus phthisis. Head lice and genital lice. Symptoms are sores, itching, feeling of something crawling on the skin. This can be cured with over-the-counter treatments and prescription medication. All items that have come in contact with infested person should be washed in very hot water and detergent, disinfected, or dry cleaned. Figure 24.4 on page 373 shows a mom looking for the nits, which is the eggs that are laid close to the scalp whenever it comes to a lice infestation. Table 24.10 on page 372 details prescription treatments for lice. So to summarize chapter 24, the skin. Skin is the largest body organ. The epidermis, dermis, and subcutaneous are the layers that make up the skin. Skin performs important functions. Diseases range from simple rashes to deadly cancers, and there are a large array of pharmaceuticals to treat skin conditions. That is the lecture for chapter 25. There will be another video to follow for this was chapter 24. There will be another lecture following for chapter 25.